Since 2005, my specialty has been spinal decompression. And in this room, we have our 2 spinal decompression tables. Spinal decompression is indicated if someone has a bulging, herniated, or degenerative disc in their lower back. Now, what that can cause is back pain, sciatica, muscle weakness, even something called foot drop, which is very serious. People are diagnosed with stenosis, which means a narrowing of the hole that the nerve is going through. And it can become a problem that a lot of people end up having back surgery ultimately. And you know, back surgery is only perhaps 50% effective. And when they say effective, it means you have a 50% chance of not being worse. So the idea here is let's fix the problem before you have to have back surgery, and spinal decompression is the treatment. Now for me, when I see a patient that needs spinal decompression, we go through a detailed analysis. If you've got MRIs or we take x-rays here in the office, we can see what's going on there and see if spinal decompression is indicated. And in all the years we've been doing spinal decompression, I would say about 90% of our patients either have their condition completely resolved or it's markedly improved to where they're very happy. You know, I run into my patients a lot at the mall or at the post office, and they'll flag me down and say, "Hey, Dr. Rik, I'm doing great. Ever since you did that treatment, you know, so many years ago, they're still having relief from their sciatica, their muscle strength is back, and they're out doing the normal activities. They never had the back surgery." And of course, that makes me feel very happy. And I also know that if you are having a problem with a stenosis or you have a herniated, bulging, or degenerative disc, spinal decompression might be exactly what you need. So give us a call.